Hello, this is Kathy Nickham, the Education Director for the DPC Education Center, and I'd like to welcome you to our July webinar on how healing works. Get well and stay well using your hidden power to heal. As a reminder, all of our lines are muted, and throughout the webinar you can type questions in the chat box and we will answer as many as we can at the end of the program. You'll also be asked to share any responses to anything that Dr. Jonas says. You're welcome to put those in the chat box as well, even if they're not questions. Within a week, we're going to have the webinar recording and the slides posted on our website. And we encourage you at the end of this program to complete the brief feedback form at the end that will give us your ideas and suggestions for additional programs as we move forward. I am excited and so pleased to be able to introduce our speaker to you today. Dr. Wayne Jonas, he's board-certified practicing family physician, a widely published scientific investigator, and an author of books including How Healing Works. He's also the executive director of Integrative Health Programs at Samueli Foundation. He was the director of the Office of Alternative Medicine at the National Institute of Health, and prior to that, he served as the director of the Medical Research Fellowship at the Walter Reed Army Institute of Research. There's many more things that he has done, and I'm hopeful that he will share additional thoughts with you in terms of his background. But at this point, I want to turn the program over to Dr. Jonas so he can share more with us about integrative health and what we can do to improve our health and management of our own situations. Dr. Jonas?
Thank you very much, Kathy. It's a great pleasure to be here, and thank you for that introduction. This is a special group for me to present to. Had a number of patients that have had chronic kidney disease as well as being on dialysis. And in fact, in my book, How Healing Works, that you just mentioned, I tell the story that I'll tell a little bit about during my talk today about a man named Trevor, who in fact was on dialysis and by adopting some of the principles and approaches we were doing began to actually feel much better and function much better during that time. I'll illustrate to you sort of how that went about that, and then point to a number of tools that you all can use to help health and healing in those areas. I don't have any disclosures. I work for a nonprofit foundation with no financial conflicts on anything I'll talk about in these areas. Kathy gave an introduction. I won't go over that. I am also, just other than to say, I'm also a professor, clinical professor at Georgetown University and the Uniformed Services University, which is the military medical school in Bethesda, Maryland. What I hope to do today is actually talk to you a little bit about where health and healing actually comes from. You may be surprised, especially for those with chronic illnesses. To talk a little bit about what's happened to the situation during the COVID pandemic and how it's impacted us across the board in society and especially in healthcare. Describe some approaches that can be brought in to enhance our care and to demonstrate how some tools can be used actually tomorrow, on Monday, or to help begin a healing journey and enhance your health. I hope on Monday you'll have a different perspective on what it means to be a whole person and how a whole person gets cared for, and how improving health and well-being can occur even in the midst of chronic kidney disease and dialysis, and that you can access some resources that will show you to do that. So the fundamental question that anyone who suffers from chronic illnesses or their family members should be asking, and their providers, is how do we merge and integrate healing and curing? how do we take what matters to the person in their life, what's important to them? And it isn't always their health, but you need health to accomplish those things, the person himself, and how do you merge that with what usually happens when you encounter the medical profession, where they're asking, well, what's the matter, in order to make a diagnosis? And it's this intersection between the person and the patient where integrative health has its greatest value. Now, you hear a lot about healthcare reform, and I would say the same question is what our legislators, payers, and deliverers of healthcare should be asking themselves. How do we get from a healthcare system to one that actually produces health and healing? And it sounds like a strange question, perhaps, but as I'll show you, healthcare does not produce most of the health and healing in our population, but it could if it were to follow these same principles. Here's the challenges that our healthcare system has right now in producing health and healing. And this is all pre-COVID. I'll show you some data post-COVID here in a minute. But this happened before the pandemic. We in the United States were first in spending of any other country, and I'll show you by how much. And yet our metrics on actual health by WHO and others put us at about 37 in the world. Close to 20% of our gross national product is estimated to be spent on medical care and health care by 2025, which is not too far away. And because of this growing cost, the equity issues, the disparities between the haves and the have-nots the disparities are increasing and the equity is decreasing. So by almost any measure, we're going in the wrong direction when it comes to producing health with our current healthcare system. Here's a report that documents a lot of that, although multiple studies have shown this over the years. This is a National Academy of Medicine, Institute of Medicine report from pre-COVID days, showing that over the last 30 years compared to other wealthy countries in the world, the United States has been declining compared to them in all of these areas that are listed right here. And we're actually not doing very well in producing health. We're not doing very well in keeping people alive either. If you look at the per capita expenditures per person in healthcare, compare that across countries, and then graph that against the life expectancy, the United States is almost double the healthcare costs of any other country, as illustrated on this graph, and yet our life expectancy is somewhere down where Portugal and Czechoslovakia are, two countries that are much less wealthy. The reason for this is also well known. If everyone were suddenly to get full, universal, platinum level health care in the country, it would actually only improve the health of our population by about 15 to 20%. And this is because most of actual health comes from outside of the medical visits, not doctor's office and the hospital. Now, this may be a little different for those in kidney disease and dialysis, but I think the figures still apply. The vast majority of health comes from behavior and lifestyle factors, both for the prevention and for the management, and social and economic issues, the so-called social determinants of disease. And so if we want a healthcare system that is producing health, we need to get out of this top little black area and begin to facilitate addressing these other areas of determinants of health. To heal, in other words, to enhance health, we need a different set of tools than we currently have in the medical profession. Right now, if you get an illness and you walk in your doctor's office, they use a tool that many of you may be familiar with. If not, I'll tell you. It's called the SOAP note. Your doctor is actually trying to put you in a SOAP box, and what that stands for is subjective, objective assessment and plan. The subjective is what you describe, the symptoms that you have. The objective are the things that the physician observes and the tests that are run. The assessment is the diagnosis, and it has to fit into a CPT code or a diagnostic code if it's going to get paid for, and the plan has to be aligned with that assessment. And it starts by asking the patient, what's the matter, okay, and then coming up with a diagnosis and a treatment plan. And the SOAP note is what's taught to all residents and medical students. It's how the electronic health records are structured, and it's how we go about doing research. So we are buried in the SOAP world within medicine. This is about curing. It's about finding the disease and attempting to eliminate it. What we need to add to this, if we really want to bring in the determinants of health that I've just mentioned and shown to you, we need different tools. And here's a tool that we've developed called the HOPE Note. This stands for Healing-Oriented Practices and Environments, and it has 4 different dimensions. Yes, the body and the external component, like you get during a regular medical visit, but it also asks about behavior and lifestyle, the social and emotional aspects of a person, and the spiritual and the mental components. 4 dimensions that actually make up what a whole person is. It starts by asking not what is the matter, but what matters to you. That's really in the spiritual and mental domain. Why do you get up in the morning? What gives you joy and happiness? What is the motivator behind wanting to have health and other things in these areas? This is a HOPE Note. Let me illustrate to you how this is done in healthcare practice, how I do it in my practice, how I teach medical students and residents, and also other practitioners and clinics around the country how to do this. Let me show you with a patient that I'll call Joe Trevor. And actually, I write about him a little bit in the book, but let me show you how we worked with Joe, or Trevor, as he liked to be called. Trevor was a Navy veteran. I worked for over 20 years in the military. I still see military patients and veterans. And Trevor came in to see me. He was a Navy veteran, and he saw me after he had just gotten out of the hospital with a heart attack, a myocardial infarction, or MI. Here's his history. His father had an MI at 65, and he died of heart disease at 75. Trevor stopped smoking then. He was 35 at the time. He then developed hypertension at 42, and unfortunately, like about half of people that run around with hypertension or high blood pressure, it was not very well controlled. It's the silent killer, they often call it. And one of the areas that it produces a lot of damage on is the kidney, as many of you know. He gained weight after he left the Navy. He then developed diabetes at 55, and at 65, he ended up with renal failure and was placed on dialysis. Now, Trevor had good medical care. He had full benefits, as military and veterans do. So he got lots of specialty care, primary care, full pills and procedures in these areas. Here's the various SOAP notes that had resulted in his treatment over the years. He had hypertension, for which he was on 2 drugs. He probably should have been on more, and other factors because his hypertension was not controlled very well. He had an elevated cholesterol, especially the bad kind, and was put on statins. He then he had type 2 diabetes, and he was placed on both metformin and then later put on insulin. He had obesity, and he went to see the dietitian. Didn't go back because he said he knew more about food than she did, and I'll show you why in a minute. When he developed renal failure, of course, then an entire world kicked in where he began dialysis 3 times a week. Now he was post-heart attack, MI. He had a stent put in, which probably saved his life, and was put on another drug, beta blocker in this case. This is what Trevor got by having good, full-blown medical care. Now, when he came in to see me to do an integrative health visit, to widen the questions to the other areas of his life in a more holistic way, I found out that Trevor was the food guy in the Navy. He actually had spent almost 40 years in the Navy, going from one food job to another. He started off peeling potatoes on a PT boat for about 15 people at the beginning of his career, and then he gradually was promoted to a full aircraft carrier and being responsible for all the food there, then finally an entire base, and then eventually they asked him to provide advice and oversee the entire Navy's program. He had seen during those 40 years a marked shift in how food was delivered and to what he also did. The food that came from scratch, the fruits and vegetables, whole foods, to what he called industrial food, things that came in packages and cans that tended to be high salt, high fat, and high sugar. Unfortunately, outside of the Navy, young recruits were also getting fed this way. They called it fast food when they got in, and the Navy said, gee, we need to go back to scratch. We need to find more fresh fruits and vegetables. Most of those young sailors didn't like that. They wanted their fast food, so it was actually difficult to get them to eat anything but the industrialized food in those areas. And he said to me, Doc, you know, I know this has something to do with the chronic conditions that I've had over the years because I ate this way too. This is something that I know is important. But nobody ever really talked to me about it except that one visit with the dietitian that I didn't go back and see. So we sat down with Trevor and I did what's called an integrative health visit using the Hope Note that I just shown you. I asked Trevor, what matters to you in life? The first thing he said was, see, I got to manage these medications. I've got all these drugs that I'm on, and every time I go in, they want to switch them around and this and that. Can you help me with that? I said, Trevor, yeah, we have a pharmacologist on our team that can help you with that. But I want to know what you do that you want to do. What's the most important thing for you in your life? And he said, you know, my dad died of a heart attack at 75. I'm getting up close to that. I do not want to do that. I want to live longer. I have grandkids. I still have things I'd like to do in my life. Can I prevent further disease? He knew that fitness and food were an important part of that. He didn't really like fitness. He wasn't really an activity buff, but he sure did like food. That's what he'd done his entire career. He knew if he was going to make some changes in this, he was going to have to engage both his family and his friends. His typical evening was to go into the club to get hamburgers and fries, meet with his buddies, and talk about their medical appointments and their health conditions. So he knew he had to do something about that. But the most important thing for Trevor, really, in terms of what mattered, is that he felt like since he retired from the Navy, he really wasn't doing anything to give back to society. He had joined the Navy because he wanted to contribute. He wanted to help our country. He wanted to help service members. He wanted to help their families. And ever since then, he didn't feel like he had a big purpose in his life. And this was really demotivating him in those areas. And so with this information, we now knew how to put together a truly integrative health plan for Trevor. And here's what the team looked like. His physician, his primary care physician, who was an internist, was really just the orchestrator of this team, the coordinator in those areas. He had his nephrologist who worked with him on the dialysis components. We had a pharmacologist that helped him manage the medication aspect and some of the supplements that he was on, and the nutritionist and a health coach and a fitness coach. Now, the nutritionist had to behave a little differently. He'd seen the nutritionist once and been told to eat this and eat that, but what was needed is that he needed to actually learn how to bring that into his life. And so there was a program that was off-post in which the nutritionist had paired with a chef and a health coach. And they began to teach how to eat healthy foods in those areas. He enrolled his family in it, told his friends about it, and he took the course. It was 12 weeks. Came in and saw me after that. He'd lost about 5 pounds. He was feeling much better, and he says, well, why didn't I know about this earlier? How come this is something that isn't available for more people, not just people from the hospital or the clinic? And I said, Trevor, that's a great idea. Why don't you do that? And so you could see the light go off in him, and suddenly his mind changed, and he saw a way he could give back. And so he actually worked with a nutritionist and became the organizer of an ongoing program in which the nutritionist, the chef, which he became the chef for this program, and the health coach invited others to participate. After a year of doing that, Trevor had lost close to 60 pounds. And during that time, not only did he feel better, but his blood pressure now got under good control just on the 2 drugs. In fact, he only needed 1 after that to control it. His diabetes actually went away, no longer needed the insulin and no longer needed the other medications. And he was left with just things necessary for his dialysis and for his cardiovascular disease, which also improved. He reduced the drugs that he needed on that. Trevor was feeling better, he was doing better, and most importantly, he was now at a much lower risk and likely to live longer. And I'll show you specifically what happens when people with kidney disease engage in these kinds of behaviors. Now, this is a different kind of health care. We call this integrative health care, and it is the merger between conventional medicine that you see in the sort of the orange top circle here, with evidence-based non-drug approaches, sometimes called complementary and alternative medicine, and self-care and behavioral change. And so if our healthcare system actually were to address this and to do it within the cultural context of health, the social determinants, it could begin to shift these numbers and improve health in ways that it doesn't do right now. So along came a little thing called COVID. Assume you've heard of it. It has wreaked havoc on the world through the pandemic, and it has in fact exacerbated some of the problems that we have seen pre-COVID that I've just illustrated for you. Primary care physicians now, many of them up to 25%, feel like they may permanently lose practice members. They don't have fulfilled staff roles, and they report significant mental exhaustion and burnout. Family decision makers report increased health crises, more mental health issues, and a rise in obesity and addiction, and the opioid crisis, which has gotten worse during the pandemic, and increase in racial disparities. Healthcare executives have found that income, especially in small and rural hospitals, has gone down as people have not come in, revenues have declined, rural systems are closing, and many improvement programs, how to improve their systems, have been put on hold during the pandemic. Major disruptions have occurred. When we look at who dies with COVID, it is the same people that were dying at higher rates before COVID. Those at high risk for hospitalization and death are listed here. The same ones, the highest one is hypertension, what Trevor had, and that can lead to renal disease. I have that circulated down there. 16% of the hospitalizations are for those with renal disease, obesity, and metabolic diseases like diabetes. It has disproportionately affected the elderly, people of color, Native Americans, Hispanics, blacks, those with chronic disease, those low income, and with poor health care, and those that could not work from home but had to do service jobs and go in and get exposed. It has had a major impact on life expectancy. I illustrated you the poor status of life expectancy compared to other countries in the United States before, and COVID has exacerbated and accelerated that. In fact, in 1 year of the pandemic, the life expectancy in the U.S. has dropped by an entire year. And it's been 3 to 4 times that drop in people of color. And so we're dying at a higher rate, we're dying at a younger rate in the COVID era. And it's not over when it's over. You've heard of long COVID. Individuals that get COVID, a good proportion of them, and right now it's estimated that a third and even up to a half have persistent symptoms, even 20 to 60 days after the infection. And these symptoms include things like fatigue and cough and headache, diarrhea, congestion, clotting problems, etc. In fact, long COVID clinics are now opening up all over the country to try to take care of these folks. COVID seems to be indiscriminate as to where it attacks. It has been found to cause havoc in almost every part of the body, including the kidneys, and it causes acute kidney injury and chronic disease, and it increases the risk for death. Even those not hospitalized who've had COVID have a 60% higher risk of death than those not infected. And it doesn't appear it matters that if you had it severely and were in the hospital, or if you even had a mild case, you're still at risk for getting long COVID disease. So before COVID and after COVID, we need a whole person approach, as I've just illustrated. The factors that were affecting us before are the same factors that COVID has magnified, and we need to look at not only the body, but the behavioral and lifestyle, social and emotional components where impact has occurred, and the spiritual and mental components. We need to take a whole person integrative approach to the management of COVID before and after. This requires a change in our thinking. In our healthcare system today, we have a wonderful acute care model. If you have a heart attack like Trevor did and came in, we can save your life. If you break your leg, if you have a pneumonia, if you need a tumor removed, we're very good at treating you like a machine, coming in and mechanically manipulating that and fixing the problem. This is the cure part. But when it comes to chronic illnesses, where the whole person is involved, we need a different mindset. I call it the ecological mindset, and illustrated to you all the 4 dimensions that need to be addressed if we're going to heal people and help them manage better. We need this shift for chronic disease in our mindset. Is this being done? It can be done. Yes, it can. Let me illustrate this by an individual and a center that we work closely with up in New York, in Queens, the Jamaica Hospital Medical Center. This is Dr. Alan Roth, Chair of Family Medicine and Ambulatory Care. Jamaica Hospital is in one of the most diverse cities in America. It cares for over 1.2 million patients, 75% of which are poor. They're either on Medicaid or they have no health insurance. So it's a safety net hospital. They were slammed with COVID in early 2020. We had started working with them before that to begin to integrate whole person integrative health practices into all of their settings. And then they were hit by one of the first surges in New York City and had to turn many of their entire pediatric hospital actually into an ICU. And now they're seeing many long COVID cases and have opened up a long COVID clinic, incorporating integrative healthcare principles and practices into their efforts. We've worked closely with Dr. Roth and his team to begin to look at how do we take care of people with chronic illnesses and the providers in the epidemic and post-epidemic. And these are some resources that have been developed with them focused on avoiding burnout, enhancing the immune system, and building resilience. We call these the Hope Note Toolkit or the Hope Note Care Tools, and it involves something called a personal health inventory to get at these factors that I just showed you, an integrative health visit, a personalized health plan that brings the healing and the curing components together, and related resources to support that process. What Dr. Roth has found is that these tools are useful not just for patients, but across his entire healthcare system and community. It helps providers with their own self-care and stress management, and they can improve performance, patients to support their healing and build resilience, including immunity, and the community in preventative care and addressing things like loneliness from social isolation and the trauma of the pandemic in those areas. Let me illustrate these tools and how those can be used, and you can use these too. Here's the personal health inventory. It starts by asking, introducing person to what a whole person is. I've just done that for you. Ask where their health is. And then it asks what's important in life, what matters to you, and it assesses the underlying determinants of healing from behavior and lifestyle that are so often not asked when you go in and see your healthcare practitioner. From that, they do HOPE, or healing-oriented note, and here's a quick assessment that you can do. These are on my website during COVID to look at these 4 dimensions and essentially do a quick checkup on how you're doing in all the dimensions of your life, from the external body, from washing your hands to protective devices, to the behavioral and lifestyle on the left lower side for staying active and nutrition, to the social and emotional components, to the spiritual and mental aspects of your life. Let me illustrate for you some of the resources that have come out of this and are available for you in these areas. I want to start with the core part of a human being, their spiritual and mental component. It's what we get at when we ask the question, what matters to you in these areas? We know, for example, that the mindset, the answer to that question about what matters, makes a huge difference in how you do when you undergo stress and trauma. Individuals, and I have had this experience in working with many veterans and military folks that got exposed to war trauma, but this applies to other types of trauma too. If you go into that expecting that the trauma is something you will bounce back from and bounce forward on, you'll grow from, that in fact is much more likely that you will than if you see the same trauma as something that is going to hurt you and damage you. And this is just the mindset. Those who thrive have strong relationships and a strong perspective on how they can use stress and trauma to improve their health. Here's some simple tools that you can use both to reduce burnout and to build resilience and shift the mindset. One is a mind-body practice. This is a mindfulness-based program that incorporates imagery in it. In fact, you can link on this, and I'll send the slides out to all of you and make them available, and do a 17-minute meditation that takes you through a deep relaxation and ends with gratitude. And this enhances how the brain functions, and it changes the perspective. Another approach is something called gratitude journaling, and I have instructions on my website at the link there on how to do this, but it's very simple. It involves, at the end of the day, writing out 5 things that you are grateful for from that day. And it can be anything. And just going over that in your mind and writing it out has been shown in itself within a few weeks to reduce stress, improve depression, and reduce burnout in those areas. 2 simple techniques that you can use to change the mindset. There's many other resources. There's a list of some others. These are all free on my website, from breathing to biofeedback to imagery. I particularly like imagery, and I've been grateful for a psychologist who is really a master at imagery to allow us to stream free on our website imagery approaches to many of these kinds of situations, for immune support, for pain and sleep, which is a very important one I use all the time, a surgery, going into surgery imagery, post-traumatic stress, and increasingly these have been translated into the Spanish language for anxiety, depression, and wellness. So these are resources. You can just go to my website, drwaynejonas.com/meditate, and stream free if needed. Here's something that came from a whole person approach that helps with patients with breathing problems, as many patients with COVID do. We know that prone breathing, that is breathing while laying face down, helps with oxygenation. Well, this is very similar to yoga postures, several yoga postures, and it's been shown that yoga and Tai Chi can improve lung function, decrease stress, and improve the immune system and quality of life. It can be done in small intervals, 5 minutes a day, 1 to 3 times a day. And here's a video that I've made on Tai Chi, one of my favorite components to address these areas. Let's look at the social and the emotional dimension in these areas. Social distancing has resulted, unfortunately, in the exacerbation of a loneliness epidemic that we had prior to COVID and made it worse. And loneliness itself hurts, including causing chronic disease. It's shown that loneliness increases inflammation and can lead to the worsening of chronic conditions, including kidney disease. It can weaken the immune system, and it increases the risk for mental and physical health, including suicide. Being able to connect, to listen to support and be supported by others is the solution to loneliness. You don't have to have a lot of friends, but if they're more than just Facebook friends, somebody that you can deeply trust, that you can talk to, this actually will relieve loneliness, and single episodes of this type of discussion and in-depth connection have been shown to improve pain, improve immune function, and lung function. Group visits are a great way to also help alleviate loneliness. And here are two leaders in the area of group visits, Jeff Geller and Shipla Saxena. The benefits of group visits, including virtual group visits for things like wellness or more disease-focused, include clinical, operational, financial, and personal benefits in those areas. Your providers should definitely look into this. They teach courses on this and begin to start group visits in those areas if they don't already do this. Health coaching is another way to actually enhance the social and emotional support and improve behavior in these areas. This is Dr. Thomas Bodenheimer. He has written the AMA, American Medical Association Guide on Health Coaching. He's at UCSF. And bringing a health coach in. I use two health coaches in my own practice to help people move into and address their underlying determinants of health. Here's a set of resources that we've put together with Alan and others, with Dr. Roth and others, to address issues of social isolation and loneliness. And even though now parts of the pandemic are improving, we're not necessarily out of the woods, and so these are things that you can use to help address the social and emotional component. Let's look at the behavioral and lifestyle dimensions in the person. Many Americans have intended and have begun to do pay more attention to self-care in the pandemic area, and yet they're struggling to actually be effective in these areas. Over 80% say they're focused more on paying attention to their health. And many of them, however, have suffered mental health and even physical health, and say they feel isolated and need help in these areas. And so behavioral change is something that your health provider should help you and support you help you to make. These kinds of things improve immune function, something we're all interested in now. And here's some basic self-care techniques that can help improve immune function. Many of these are obvious, but the support to improve them, and some of the data many people don't know. Don't smoke and drink alcohol. This can impair your immune cells, relax and lower your stress, makes it actually less likely that a virus will take. Sleep is key to maintaining resistance. Getting fit and getting out in nature will increase natural killer cells to protect us against not only infection, but cancer and other conditions. And then there are some things that appear to improve health and well-being and the immune system. I've listed some foods there. Many of these foods are spices, and those spices have anti-inflammatory effects. And so they can reduce the inflammation in your body, which in turn improves pain and reduces the likelihood of a post-COVID problem. There's a growing body of evidence, and here's a publication that reviews the adoption of an anti-inflammatory diet and supplements like vitamin D, glutathione, and herbal products Other things like manipulation, qigong, breathing exercises can help with pulmonary recovery, and of course stress reduction techniques in these areas. However, you have to be careful about these areas, and you should discuss these with your doctor. We've just come out this week with a Harris poll we supported looking at supplement use during the pandemic, and there has been an increase in supplement use by over 26%, much of it because people are trying to improve their immune system. Here's an example of a patient that came to me that had COVID. He was not hospitalized, but he had symptoms, and he wanted to know what to take. Here's a list of the things he had collected to take: vitamin C, zinc, quercetin, melatonin, vitamin D, as well as asked for off-label drugs like ivermectin, aspirin, hydroxyquinone, and prednisone. Don't go into these areas without consulting with your doctor, especially if you have renal disease or on dialysis. Many of these things do not work, and I've linked you to some studies that have, rigorous studies that have looked at this in those areas. I'll show you in a bit some of the supplements that you should be paying attention to, and some that you have to be very cautious about if you have chronic renal disease, kidney disease, and are on dialysis. The final area is the behavior in the body and the external environment. And here's some tidbits to look at the external environment that might help. Now, obviously, you need to double down on reversing and treating the underlying things that make both kidney disease and the risk for COVID worse. I've listed those on the left: high blood pressure, obesity, diabetes, cardiovascular disease. Also follow the guidelines for keeping safe from the CDC. Get the vaccine. If you have renal disease and you're on, or if you've had a renal transplant, the need for a booster is probably likely, so you should actually have that tested. Trevor, who I mentioned to you before, had a renal transplant and he was on immunosuppressive drugs. He got 2 doses of the vaccine, but then actually didn't develop antibodies very well. He thought he was safe. He went out and he then contracted COVID and is currently in the hospital, unfortunately. Mask outside, social distance, keep surfaces clean in those areas. Will these things help with chronic kidney disease? Yes, chronic kidney disease is a condition that affects the whole person, as I've just illustrated. And it's highly sensitive to behavior and lifestyle changes, and so it's the ideal situation in which to do integrative health care. Not only can it help you, with the disease itself, but it can help manage symptoms, slow progression of disease, and lessen the stress of dialysis. Conventional treatments are important. Use those first, of course, and always monitor and control your blood pressure, sugar, kidney function, and comply with medications. But then go beyond that and optimize your lifestyle. Eat a heart-healthy diet, which is also good for the kidneys. Move more and manage your stress. Many complementary approaches like acupuncture, yoga, tai chi, and qigong can improve well-being and function, and can help even in chronic kidney disease. And to help answer Trevor's question of how do I keep from dying, how do I reduce my risk factors even with chronic kidney disease, he could do that because it's been shown that patients can reduce their risk of death by almost 70% if they follow 4 basic lifestyle factors. Don't smoke, keep active, eat a healthy diet, and don't get overweight in those areas. This is, is something that your healthcare providers can help you attain. Supplements are easy to get. You can order them online. You can take them. Many patients do, and that's increased during the pandemic. But if you have kidney disease or on dialysis, you have to be especially cautious about them. There's a number of supplements that can interfere with medications and immunosuppressive drugs. As you know, potassium and other electrolytes are very sensitive in renal disease. Certain foods like star fruit and other things can be toxic, like aristotropic acid. Stimulants, you also have to be careful in terms of raising blood pressure and other things. So if you are going to go on supplements, then make sure you talk to your doctor and make sure you do it in a safe manner. Here's some things that your doctor ought to be talking to you about in terms of supplements, because they're often things that go haywire or that people with kidney disease need. B vitamins especially are listed in the top 2 lines. Iron, especially to prevent anemia. Vitamin C, but again, it has to be carefully monitored because of its potential to produce oxalates that might hurt the kidneys. Vitamin D is frequently low in dialysis patients, and we now know that vitamin D is very important for health maintenance across the board as well as the immune system, including resisting COVID, calcium, and other types of supplements for healthy bones are especially important in kidney disease. Now, unfortunately, the supplements that you buy over the counter are not regulated very well, and so you have to be careful. Make sure you look for brands that have been certified by the NSF International, the U.S. Pharmacopoeia, or the Consumer Lab Seal. These are organizations that check out supplements to make sure they're not contaminated and toxic or have some other problem with them. The physical environment by itself can be an important area for healing. The internal space is important. The external space, being out in nature. Here's some links to some blogs and some videos that I've done about walking meetings, about the healing power of outdoors. There's a great company called Envia that talks about the optimal healing environments. Check that out there. And if you see other things that are especially useful in chronic kidney disease, please email me or email our Director of Communication to make them available. So how does this all get put together? What can you, your doctor and healthcare team do? Well, of course, you want to continue your standard of care. Don't abandon conventional medicine. This can get you into trouble. And it did for a little while with TREVOR'S, as you'll see if you read that section of the book. Ask them to do an integrative health visit. The tools that I've just shown you are available free on my website, Personal Health Inventory and the Hope Note, and go through those questions. Take those and sit down and talk with your healthcare team. Add some simple methods, ear acupuncture, mind-body practices, nutrition, and safe supplements. Advanced healing technologies such as biofeedback and behavioral apps can be helpful. And then look for practices in which they've redesigned the healthcare team to incorporate health coaching, team care, group visits, and shared decision-making. These tools are all on the website. If they ask, how do I do this? If your provider is interested in this, they can go there. We have an instruction book on how to do that with all the tools, telling them how to prepare, how to do the visit, and how to do ongoing support. And there is a series of resources, including evidence summaries, operational things like coding and billing frameworks, and patient outcome measurement tools. So all the tools are there. I have a number of groups around the country that are doing it themselves, just using these tools. For patients, if you are somebody with chronic kidney disease, then we have produced a guide to integrative health for those with chronic kidney disease, and you can go to my website, drwaynejonas.com/CKD. We have the current version we're finalizing, but we do have it mostly complete, and it's already on the website. So go ahead and go there, sign up for my newsletter, and sign up, and you can download this. And we will then send you a final and enhanced version when it comes out within a few weeks in those areas. Well, I hope that this has been helpful for you. The goal here is to make whole person care routine and regular. This can be done now. The tools that are available to integrate conventional care, self-care, complementary medicine are something that you can do. Not only do we show you that to you on the healthcare on the website, but in my book, How Healing Works, I tell you how patients have done this and how I learned about the importance of doing this from patients in my practice. So again, I'd like to thank the group and Kathy and others for inviting me to speak. I hope you found this useful, and I look forward to some questions and dialogue for a few minutes. Thank you. Okay. So hopefully Kathy's on and can take over the questions. I believe that he's asked people to put them into the chat box and has been collecting those and I think collating them.
Thank you so much, Dr. Jonas, for that really great presentation. There's a lot of really good information in it, and I know even those without kidney disease have a lot. There were a lot of takeaways that's applicable to everyone. It looks like we do have one question that's been put in the chat box. So we have someone asking, being on several medications for blood pressure control, how bad is it for people with CKD?
Yeah, so I guess the question, Sam, you're asking is how bad are the drugs for people with CKD? And as I tried to illustrate with the story with Trevor, he was not on enough drugs actually for controlling of his blood pressure. Close to half of people with high blood pressure in the world are not under adequate control. And there's very good evidence now to show that if you can keep your blood pressure down and keep it under control, it will slow down or prevent a lot of renal or kidney disease. And so it's not only not bad for kidney disease, it's important that you stay on the medications that are needed to control individuals' blood pressure or your blood pressure. Now, that said, if you look at the guidelines, the national guidelines for controlling high blood pressure, they say that you should incorporate regularly behavioral and lifestyle, which also can reduce blood pressure and make, in many cases, the requirement for medications less. And even though those guidelines say that, very few places actually take the time to work closely with patients to make the kind of behavior, exercise, diet, stress reduction recommendations that those guidelines say that have been proven to lower blood pressure. And so it is possible to reduce the medications that you're on and in many cases control your blood pressure, but you don't want to get off the medications unless you're engaged in those and your blood pressure is under control.
Thank you.
Like Kathy says, she's having some phone issues.
Not a problem. Well, if we don't have any more questions right now, Dr. Jonas, thank you so much again for the great presentation and for being here with us today.
It is my pleasure, and I wish you all a great day and health and a well-being in your life.
Thank you very much. Right, so thank you again, everyone, for attending. And when you exit the webinar, there will be a feedback form that should pop up for you. Please do take a few minutes to fill that out. That really helps us and gives us more information about what could be helpful and useful topics for the future. And we'd also like to invite you to join us August 19th for our next webinar, getting a good night's sleep. So thank you again, everyone, and we hope you have a great rest of your day.